I want you to try something, just for a second. If you can, just bend your arm, flex your bicep, and look really closely at the movement right under your skin.
Yeah, just watch how it shifts.
Right. And what does it look like? I mean, most of us today, we might see a knot tightening up, or maybe like a mechanical system of pulleys and levers engaging.
Because that's our modern frame of reference.
Yeah, exactly. But if we rewind the clock a few thousand years, ancient observers didn't really have mechanical analogies. To them, the way that tissue rippled and darted under the skin well, it looked remarkably like a tiny mouse scurrying just beneath the surface.
It's a very visceral image.
Yeah.
And honestly, once you visualize it from that pre-industrial perspective, you can't really unsee it.
You really can't.
The way a muscle flexes and twitches, it genuinely mimics a small animal just trapped under a blanket.
And the fascinating part is that this visual, it wasn't just some bit of ancient poetry that faded away over time. It became the literal foundation of our modern medical language.
It really did.
I mean, the everyday English word muscle, along with all those dense clinical prefixes we see on hospital charts, like myo and musculo, they literally translate to mouse or little mouse in ancient Greek and Latin.
And which is pretty wild when you think about it. And that perfectly defines our mission for this deep dive.
Unpacking the medical terminology of muscles.
Exactly. We are looking at this totally interconnected system that relies on those two classical roots, right? The Greek myo and the Latin musculo.
Because it can be super intimidating when you see it in a real medical setting.
Oh, absolutely. So our goal today is to demystify this high-stakes vocabulary, map out the historical divergence between these two terms, and give you the conceptual decoder ring you need to actually read a hospital chart or a fitness injury summary without just feeling completely overwhelmed by the jargon.
Right. And to understand the modern application, we really have to establish how we inherited this dual system in the first place. Because it's not like medical terminology was handed down by some unified committee in a modern laboratory.
No, not at all. It's just this messy accumulation of history.
Yeah, so we have the Greek mys and the Latin musculus. Both meant mouse, and both were used to describe what we now know as contractile tissue.
Right, and it's interesting because the Greek word mys functions as the exact same word for both the animal and the anatomical structure. There was no distinction.
Wow.
Yeah, Greek physicians operating in the Hippocratic and Galenic traditions, which is spanning roughly the 5th century BCE through the 2nd century CE, they used it as their standard anatomical identifier.
So people like Galen.
Exactly, Galen of Pergamon. His writings basically dictated Western medical thought for over a millennium, and he leaned heavily on mys in his extensive dissection records.
Okay, so that's the Greek side. What about the Romans?
Well, on the other side of the Mediterranean, you had Roman writers like Celsus in the 1st century CE. He utilized musculus, which is actually the diminutive form of mas, so it directly translates to little mouse.
A little mouse.
Yep. And the Romans applied it in the exact same anatomical sense as the Greeks.
Wait, okay, so if both empires were just observing the exact same visual phenomenon and they both named it after a mouse, how did this not consolidate into a single term?
That's the logical question, right?
Yeah, because scientific terms usually trend towards standardization. I mean, we talked in a previous deep dive about how Wilhelm Johansen deliberately coined the word gene in 1909 to, unify a concept. But here we have two competing ancient folk metaphors just surviving side by side into the 21st century.
It's a great point. And the survival of both terms really comes down to the fragmented, often messy evolution of European medical education.
How so?
Well, fast forward to the Renaissance. Anatomists like Andreas Vesalius are performing these groundbreaking human dissections, and they're publishing foundational texts. Vesalius's 1543 masterwork was written entirely in Latin.
Because Latin was like the lingua franca of Renaissance scholarship.
Exactly. So he utilized musculus extensively. And because of texts like his, the Latin root effectively cornered the market on structural anatomy.
Oh, I see.
Yeah, whenever anatomists were mapping the body and naming its static parts, they defaulted to Latin.
Okay, that makes sense for the Latin dominance in anatomy, but the Greek mys didn't disappear. It obviously stuck around. It must have found a different niche to survive the Renaissance.
It did, but it actually found its niche centuries later.
Really?
Yeah, during the 18th and particularly the 19th centuries, the field of pathology began to mature really rapidly. French and German pathologists were identifying all these new diseases and cellular processes.
So they needed a new vocabulary to describe these conditions.
Precisely. And there was a strong intellectual trend in European universities at the time to view Greek as the more sophisticated, scientific, and theoretical language compared to pragmatic Latin.
Oh, interesting. It was like a status thing.
Totally. So when pathologists began coining new terms for diseased tissues or abnormal states, they grafted Greek roots onto Greek suffixes.
Which means we ended up keeping both words for the exact same biological tissue, which is honestly a massive point of confusion for anyone trying to navigate the healthcare system today.
It is a massive hurdle.
I mean, students and patients alike constantly assume that myo and musculo must refer to fundamentally different types of tissue in the body, but they don't.
No, they don't.
Huh.
And instructors spend an inordinate amount of time actively correcting that assumption.
I bet.
A learner might logically deduce that, oh, myo refers to fast-twitch fibers, and musculo refers to slow-twitch fibers. Or maybe one is skeletal muscle and the other is smooth muscle.
Right, because why else would we have two words?
Exactly, but none of that is true. Biologically, they are true synonyms.
Hmm.
They represent the exact same contractile tissue responsible for movement and heat generation.
You know, it seems like a massive software system built by two different development teams.
Oh, I like that. How do you mean?
Like, the Latin musculo functions as the front-end user interface. It's what you use to name the structures, the buttons, the architecture. But the Greek myo functions as the back-end error log. It's the language the system outputs when the machinery breaks down or gets a virus.
That software analogy captures the operational reality perfectly. The split is discipline-based, not biological.
Right.
Myo dominates the clinical and pathological vocabulary. When you are sitting at the bedside dealing with a diagnosis and inflammation or some degenerative condition, you are operating in the Greek back-end error log.
That's why you see myopathy for muscle disease.
Exactly. Or myocarditis for inflammation of the heart muscle.
Yeah.
Conversely, musculo dominates the anatomical descriptive vocabulary.
The front-end architecture.
Yes, which is why we refer to the musculoskeletal system or a patient's overall musculature.
So, like, the World Health Organization tracks what they call musculoskeletal conditions, and they estimate those affect around 1.71 billion people globally. So they're categorizing the structural system using the Latin front-end terminology. But the moment a patient with one of those 1.71 billion conditions walks into a neurology clinic for a specific diagnosis, the specialist switches to the Greek backend to code the actual disease.
You've got it. Though we should probably note that this UI versus backend division is a soft convention.
A soft convention.
Yeah, it accumulated over a century, rather than being a hard rule handed down by a modern medical board.
Oh, okay.
Gross Anatomy codified its terminology through international agreements, like the Terminologia Anatomica, which is overwhelmingly Latin.
Sure.
Meanwhile, specialized clinical fields like cardiology and neurology, which formalized much of their diagnostic criteria during that 19th century boom in pathology, well, they remain heavily reliant on the Greek myo.
Okay, so we've established the historical split, and we have this structural instruction manual, basically. Let's look at what happens when that back-end system throws a critical error.
Let's do it.
Because seeing these Greek and Latin mashups on a hospital chart can induce absolute panic. The sources we're looking at discuss myocardial infarction.
Right, which sounds terrifying. But medical terminology functions as a modular construction kit. You identify the root for the structure involved, and you attach a prefix or suffix denoting the process.
Breaking it down piece by piece.
Exactly. Breaking down myocardial infarction demystifies the condition entirely. We start with the muscular layer of the heart wall, the myocardium.
Okay, so we use the Greek myo for muscle.
Yep, combined with cardio for heart, and the suffix, which simply denotes a structure or tissue layer.
Okay, the structural part is pretty straightforward, but the infarction half of the term is where the actual pathology lies, right?
Yes. The term infarct is derived from the Latin verb infarcere, which means to stuff or to plug.
Oh, wow. To plug.
Yeah. It describes the physiological mechanism of the disease. A vessel becomes plugged, which starves the tissue of oxygen and leads to cellular necrosis or tissue death.
So a myocardial infarction is literally the death of the heart muscle structure due to a plugged vessel.
Exactly. And the Centers for Disease Control and Prevention notes that roughly 800,000 Americans experience this specific physiological cascade every single year.
It's incredible how breaking the word down strips away the abstract terror of the phrase heart attack.
Yeah.
You know, it replaces it with this precise mechanical description of the failure, a plugged vessel starving the heart muscle.
It gives you a sense of control over the information.
Definitely. Now, the sources also highlight a term that sounds even more alien and catastrophic, honestly. Rhabdomyolysis.
Rhabdomyolysis. This is a very high-stakes clinical scenario that utilizes three distinct Greek elements.
Okay, walk us through it.
We begin with rhabdo, meaning rod or striated. This refers directly to the striped, organized appearance of skeletal muscle fibers under a microscopic view.
Okay, rhabdo is striated.
Then we add myo for muscle, and we append stylolysis, which indicates destruction, breakdown, or separation.
Wow, okay. So we're looking at the literal destruction of striated skeletal muscle.
Exactly.
But the stakes of this condition aren't just local muscle damage, right? The sources indicate the breakdown triggers a massive systemic crisis.
Yeah, the localized muscle destruction initiates a really severe systemic cascade. When skeletal muscle tissue breaks down aggressively, it ruptures and spills its intracellular contents directly into the bloodstream.
That sounds bad.
It is, and the most critical component of this spill is a protein called myoglobin, which is simply myo combined with globin.
What does myoglobin do normally?
Myoglobin is the muscle's dedicated oxygen-storing protein. It functions very similarly to hemoglobin in the blood.
Okay, and the kidneys are responsible for filtering the blood. I assume a sudden flood of muscle protein isn't something the renal system is designed to handle.
Not at all. The renal system is entirely unequipped for it. When massive quantities of myoglobin reach the kidneys, the protein effectively clogs the microscopic filtration tubules. And it gets worse. Furthermore, myoglobin breaks down into toxic compounds that cause severe oxidative stress to the kidney tissues.
So it's a double whammy.
Exactly. This combination of physical obstruction and chemical toxicity can rapidly lead to acute renal failure.
You know, we see this reflected in the news every summer. Stories will break about incoming college football players, military recruits, or even extreme amateur athletes who participate in these uncalibrated, beyond their limits conditioning sessions.
We see it entirely too often.
Yeah, and they end up hospitalized, sometimes requiring dialysis. The media often frames it as extreme dehydration or exhaustion, but what they are actually describing is acute rhabdomyolysis.
That's exactly right.
The physical trauma of the workout has literally sheared their muscle cells apart, dumping myoglobin into their blood and suffocating their kidneys.
The clinical reality is just as dramatic as the terminology suggests. But beyond acute trauma, this modular language also absorbs complex genetic realities. We see this in the term muscular dystrophy.
How does that one break down?
We apply the prefix dys, meaning bad, difficult, or abnormal, to trophy, meaning nourishment or growth.
It's notable that the clinical name pairs the Latin muscular with the Greek dystrophy as two separate words rather than, fusing them into a single compound word.
That's a great observation. That stylistic separation is really common when designating a broader clinical syndrome rather than a single physiological event.
Makes sense.
And the historical gravity of muscular dystrophy really illustrates how deeply these linguistic roots anchor modern science.
How so?
Well, the most severe and prevalent childhood variant, Duchenne muscular dystrophy, was systematically categorized by the French neurologist Guillaume Benjamin Armand Duchenne in the 1860s.
Back in the 19th century.
Right, and he based it entirely on clinical observation and early biopsies.
So he was diagnosing the breakdown of the, quote, nourishment and growth of the muscle without actually knowing the underlying biological mechanism.
Exactly. He had no idea about the genetics.
Yeah.
Over a century later, in 1986, geneticist Louis Kunkel and his laboratory team finally identified the specific genetic mutation responsible for the disease.
Wow, over 100 years later.
Yeah, they discovered the largest known human gene, which produces this vital structural protein in muscle cells. And when naming this newly discovered protein, they didn't invent a modern acronym or some sterile number.
What do they call it?
They honored the historical pathology and named it dystrophin.
That's actually really cool.
Yeah, the cutting-edge molecular discovery was seamlessly integrated into the ancient Greco-Roman linguistic framework.
We've mapped out how effective this construction kit is when the components are assembled correctly. But the inherent danger of a highly modular, precision-based language is that a single typo or just a misheard syllable changes the entire architecture of the word.
It's a huge liability.
A minor coding error doesn't just result in a misspelling. It diagnoses the patient with an entirely different biological crisis.
And this vulnerability of the system is a major focus in medical education and hospital administration.
I can imagine.
The highest yield mix-up, the most perilous error in both the classroom and clinical documentation, is the confusion between myo, meaning muscle, and myelo, meaning bone marrow or spinal cord.
Myelo.
Yes, the latter derives from the Greek myelos, referring to marrow.
Genetically, they are incredibly close. I mean, myo and myelo.
Yeah.
Visually, they are separated by just an E and an L. If a physician is dictating a chart rapidly, or a transcriptionist is parsing a noisy audio file, the difference between those two is razor thin.
And the implications of that razor-thin margin are massive. Consider the difference between myopathy and myelopathy.
Right.
Myopathy indicates a disease of the muscle tissue, perhaps requiring a rheumatologist or some physical therapy.
Okay, muscle disease.
But myelopathy indicates a disease or compression of the spinal cord, potentially requiring immediate neurosurgical intervention to prevent paralysis.
Oh, wow.
Yeah, the entire clinical pathway diverges based on those two letters.
The same applies to oncology, right?
Yeah.
If a chart reads myoma, the patient has a benign tumor made of muscle tissue. But if the chart accidentally logs myeloma, the system routes the patient toward treatment for a malignant cancer of the bone marrow, like multiple myeloma.
Exactly. It's a terrifying prospect.
How do modern healthcare systems, particularly electronic health records, mitigate this kind of catastrophic routing error?
Well, the mitigation starts in terminology courses, where these specific synonym pairs are aggressively drilled into students. Textbooks explicitly flag myo and myelo as a critical watch-out pair.
You literally have to train the humans first.
Exactly. In practice, the transition to standardized coding systems like ICD-10 really helps, because the specific alphanumeric code requires a secondary layer of verification beyond just the written word.
That makes sense.
However, the risk remains a genuine operational hazard. The precision of the language dictates the diagnostic workup, the specialist consultations, and the prescribed treatments.
You know, to truly appreciate the precision required, we need to look at the immediate linguistic neighborhood surrounding myo, because the terminology doesn't just stop at the gross organ level, right? It scales all the way down to the microscopic architecture of the tissue itself.
It does. The surrounding terminology provides a beautifully nested hierarchy of specificity. For instance, we have the Greek root sarko, meaning flesh.
Sarco.
In modern medicine, sarco is frequently deployed to describe muscle tissue at the cellular or microscopic level. You encounter it in terms like sarcomere, which is the fundamental contractile unit of a muscle fiber,
Oh, okay.
or sarcopenia, which is the clinical term for age-related loss of muscle mass and function.
So myo or musculo names the macroscopic organ you can actually see and dissect, while sarco zooms in on the microscopic flesh that constitutes the organ.
Precisely.
The language dictates the magnification level.
It does. Furthermore, we have compound roots that categorize the specific histological type of muscle.
Like what?
Well, leiomyo is used exclusively for smooth muscle, deriving from the Greek leios, meaning smooth.
Okay.
If a patient is diagnosed with a leiomyoma, the terminology specifies a benign tumor composed specifically of smooth muscle tissue. This is the precise clinical term for what is commonly known as a uterine fibroid.
Oh, I've definitely heard of those, but never the actual medical term.
Right. And finally, the system incorporates the connective infrastructure with roots like teno and tendino.
Ah, for tendons.
Exactly. Referring to the tendons that anchor the muscle to the skeleton, which we see in really common inflammatory conditions like tendinitis.
All of this interconnected vocabulary really circles back to a fundamental question for anyone listening who isn't, actively enrolled in a medical coding program or a nursing degree.
Sure, why does this matter to the layperson?
Right. We've traced ancient translations, software analogies for anatomy and pathology, and the terrifying renal failure mechanisms of rhabdomyolysis. Why does possessing this specific decoder ring actually matter for you, the listener?
It's a great question.
I think it matters because interacting with the healthcare system is an inevitability, not a probability. Whether you are parsing your own hospital discharge summary, trying to comprehend a physical therapy assessment for a musculoskeletal disorder, or evaluating the news about emerging gene therapies. Understanding the underlying mechanics of this language is just a crucial component of personal health literacy.
I couldn't agree more. Health literacy is entirely dependent on removing the intimidation factor from the vocabulary.
Completely.
These words are not esoteric academic puzzles. They are the functional labels for the leading global causes of disability, intervention, and mortality. When you understand the modular nature of the prefixes and roots, a medical chart transitions from a terrifying wall of jargon into a logical, readable schematic of your own body.
Knowing the functional difference between an error in the myosystem versus an error in the myosystem transforms you from a passive recipient of medical care into an informed participant. you can actually understand the nature of the mechanical failure being described to you.
There's also a broader philosophical takeaway here regarding how human knowledge scales.
Oh,
We are rapidly entering an era dominated by genomic medicine, CRISPR gene editing, and AI-driven diagnostic models that can read a patient's entire biochemical profile in
a
seconds.
future is now.
Yet all of these hyper-advanced futuristic interventions are still fundamentally tethered to the observational language of antiquity. The terminology didn't become more synthetic or purely mathematical as the science advanced. It stubbornly carried its history forward.
It really makes you wonder what happens to this linguistic framework 50 or 100 years from now. I mean, as our medical interventions move entirely to the molecular and genetic level, will we eventually outgrow this Greco-Roman system?
It's fascinating to think about.
Will artificial intelligence simply reference a genetic locus and bypass words like myopathy altogether, rendering these ancient roots obsolete? Or are we permanently locked into this biological operating system, endlessly building new diagnostic codes on the backs of little mice scurrying under our skin? Something to think about.